What causes depression? Can it be prevented?
Well, first of all, you have to understand that there are many, many different types of depression, many. So to say what causes it isn't so relevant because we could go through some of the causes, but it's not necessarily a very clear answer. As an example, let's say a child, 5-year-old child, loses a parent. Let's say a mother. At that age, we know that that can have a profound effect on that child's psychological development. So that's a clear-cut cause that could maybe show up later in life. It doesn't necessarily have to show up at the time when it happens. Another thing that could cause depression, let's say in an adult, a person has a career and all of a sudden they lose their job. They can become depressed because their whole life was that career. Then we have other types of depression. We know that sometimes it's a hereditary cause, meaning that if one or maybe both your parents had been depressed during their life, or maybe your grandparents, that we do know that there's some people who actually inherit the disposition of those parents. And they've done some studies on that to show that even kids who were raised by different parents will sometimes have the characteristics of their biological parents. Then there's depressions that we don't know why it happened, why it's caused. We don't see a hereditary thing, but the person is born with a disposition of being somewhat depressed. Sometimes parents will say, this child was that way from the get-go. Many of the, what you call diagnoses of mental illness, often have a depression aspect of it. So it's very varied. You could look at maybe 50 different possibilities. Then there's some with drugs. When people take drugs and alcohol excessively, they can become eventually depressed. Usually a psychiatrist, but not always, gets the person off the drugs and alcohol before they're ready to make a diagnosis that the person is depressed. And some of them say, I have to wait 3 months for the person to be totally clean for me to say that that depression was there before the alcohol and drugs. Depression can be treated, it can be prevented. Prevention, I can give you an example. The child, the first example I gave earlier, the child who lost a mother, say a 4-year-old. Can you prevent the depression that might likely erupt or evolve in that situation? You can. By giving maybe the child the necessary support, the necessary ability to heal emotionally, that child can go into life without becoming disabled because of that loss. Another situation would be talk therapy. Talk therapy often is very helpful for people who have depression. Medication often is helpful. In fact, some studies show that the best way of dealing with depression is a combination of medicine and talk therapy. Sometimes a different perspective on life a person could gain that will cure or help their depression. Meaning, sometimes a person loses a job and they're depressed for a while. Maybe somebody can give them a different perspective. I remember hearing a story about Elie Wiesel when he was told that Bernie Madoff did away with all of his savings. He had invested his savings with Madoff, and this is near the latter part of his life. He made a comment to the reporter. He said, there are bigger things to lose in life than money. He had a good perspective on it. He didn't see it as devastating. And he knew he was in the Holocaust and he saw his father die right in front of his eyes. So for him, losing money wasn't so important. And I think that statement might have helped other people in their dealing with that issue.